Teenagers in Quebec are struggling with serious mental health issues at a rate never before seen. Tel-Jeune, the youth helpline, says requests for help are up 20% and are expected to reach 60,000 before the end of the year. Dr. Tamara Soles is a child psychologist and joins us now. Thank you for being here.
Thank you for having me, Matt.
So, Dr. Soles, what are you seeing in your work with young people?
Well, this report is alarming, and I'm glad that we're talking about it because it mirrors what we see in our clinics, in private practices, and in the public sector, which is that there are young people in increasing distress, and we're seeing an increase in anxiety, depression, and suicidal thoughts and suicidal ideation. So it's really important that this report is coming to light and being highlighted because we really are seeing these young people in distress.
Yeah, one very shocking detail from that report from Tel-Jeune was 1 in 5 interventions now are leading to a suicide risk assessment. Does that mean that the severity of these cases is getting worse?
That is an important thing to shine a little bit of light on because not to diminish it, but the fact that 1 in 5 are being assessed for suicidal ideation doesn't mean that 1 in 5 are actually suicidal. Many of those would result in someone being deemed safe. But nevertheless, that is something to take seriously, and it's important that we assess that risk. And there is an increased risk and prevalence of suicidal ideation currently. So it's an important and alarming stat that came to light in that report.
Yeah, we've been hearing about the rise in sort of youth mental health issues for some time now. What do you think is behind it, and what's making it get worse and worse year after year?
You know, there's definitely been a lot of talk about cell phones, and I know we'll talk about that in a second as well. And in many ways, I think we're kind of hanging our hats on technology as the sole culprit behind this, but there are many things. One of which is what happens as a result of increased screen time, which is disconnection. So when we see increased disconnection from family, from community, from friends, face to face, and couple that with increased stressors from school. We're expecting children and teens to achieve, to get top grades, to go to top schools. That increased pressure sitting alongside decreased connection is really increasing the risk for many of those. So while screens and technology may be a part of that, it's also the impact of lack of sleep and lack of the bigger picture things that impact our overall well-being.
Do these mental health issues manifest in ways that are different with young people versus adults, or is there a bit of a correlation there?
I think it's important to keep in mind that young people are still working with an underdeveloped brain, and so their ability to regulate their emotions is still fragile and vulnerable, and their impulse control is less developed, so it also means they're maybe at increased risk for making impulsive and risky choices. And because they're still working on that emotion regulation, we may see those more intense waves of emotion and those bursts of emotion that they're struggling to manage.
You mentioned the cell phone ban a little earlier. One of the things that Tel-Jeune put out was that it was a big factor in creating anxiety in children, school-age children at the beginning of this school year. What do you make of that? Because I think a lot of people expected take the phones away and perhaps some of that anxiety or stress might go away, and it seems the opposite is true. How do you explain that?
I think there are a few things happening here that are important to look at. So one is that the cell phone ban took effect at the beginning of the school year, which is already in transition time. And transitions are notoriously difficult for children and teens. And to add that layer of what is school going to look like without my phone? How am I going to connect with friends or even connect with supports like Tel-Jeune? That level of uncertainty contributed, I'm sure, to some increased distress and the timing of that. The other thing to think about is the fact that what may be happening is a delayed response, meaning that some kids and teens were using their phones to connect with support during the day. And if they are no longer able to do that, they may be waiting until they're home and then reaching out to helplines. And by then, what might have been caught earlier in the day and managed might become a higher level of distress later. So I think there's a few things that are going on, but one of the most important things to keep in mind is while a cell phone ban may be an important part of the picture, a cell phone ban is not a mental health policy. So if we really want to focus on wellness, we need mental health policies to sit alongside a ban.
All right, Dr. Tamara Soles, thank you so much for your time.
Thank you for having me.